this is a very exciting congress. For the first time, doctors in the different regional Victorian are getting together to learn from each other and to work out a way to recruit and to retain junior doctors so that we can develop a good training program in regional Victoria. That's the whole idea.
And we're agitating for doctors to work in rural and regional Australia, which make up roughly 30% of our population. And Anne Webster said it, very well this morning. Why should our health outcomes be defined on our postcode?
It's been good to hear other people's stories about their training in regional and sub-regional and rural areas. I think sometimes because there's less of us in regional areas, we might feel like there's less of us and we've got less of a kind of benchmark. But it's good to hear other people's stories and what they've been up to. Makes you feel like there's really a lot of us out there doing good things.
Never lived in a rural place, so coming up to Mildura for my placement was a bit scary, but I loved the community. I loved the kind of lifestyle you can have and just knowing everyone, seeing people from the hospital and the streets, and just how much people care and about the patients in the hospital and how friendly they are. It's such a great community to be part of, and I think that kind of topped it all for me. On top of clinical experience and the one-on-one mentorship you get when people really know who you are, as opposed to in the cities where you can kind of blend into the background a little bit.
I had never done any rural training before. I'd never been to any rural places before. I'd never been to Echuca in my life before I applied for internship there. But I think just take the jump. It was so worth it for me. I'm unbelievably supported. The experiences I'm getting are second to none, much better than my peers in the city. Sorry guys. It's just fantastic. They make a place for you, and I just don't think that they do that in a Melbourne setting. In the bush, they will make a spot for you. They need you, they want you, they will go above and beyond for you, and it's just so worth it.
To get graduates from the health professions to stay in the area, you've got to have local pathways in which they can engage in. It's no good having pathways in the city because that's the obvious way to lose them.
I always thought I'd be going to a rural place for my training. It definitely made me realise that there's flexibility in maybe starting somewhere, being able to move somewhere else. You're not necessarily confined to being in one place. There's no stigma attached to starting your training in Mildura, moving over to Gippsland and sort of doing a bit of a lap of the map, if you will. That's probably something that I've noticed from listening to some of the people at the Congress, just having conversations today.
People always say if you go to rural Australia, you will miss out on training opportunities, and that is true. But if you stay in the big cities, you will also miss out on opportunities, and I think it's about what opportunities you want to miss out on. So what I don't want to miss out on is I don't want to miss out on hands-on training. I don't want to miss out on being a part of the patient's stories and knowing what ends up happening to them. I don't want to miss out on knowing that you can make a difference to people and see that difference. It's what you get in regional, rural training that you wouldn't get in the city. You need to have a life. We're mentioning work-life balance in medicine all the time, but it's much easier to do in regional Australia where things just don't take so much time. It's just much easier to do that.